Hello everyone. So now we will discuss the new drugs approved after our last discussion. So we had discussed around in the August or September 2018. So the drugs which are approved after that, we are going to discuss that. The first one, prabotulinum toxin A. So it's easy to remember. It is botulinum toxin. Botulinum toxin type A. We know anticholinergic drug. Botulinum toxin is anticholinergic. It inhibits the release of acetylcholine and it is acting as a muscle relaxant. So it is used for glabellar lines. Improvement in the appearance of moderate to severe glabellar lines. Second new drug is glycopyrronium. Just similar to the name, you can correlate glycopyrrolate. Remember, we studied in glycopyrrolate in anticholinergic drug. So similar drug is glycopyrronium. It is anticholinergic drug like glycopyrrolate. So mainly it decreases the sweating. So it is used for primary axillary hyperhidrosis to decrease the sweating. And it is applied in the form of cloth. So cloth has to be applied topically on the axilla. On one cloth need to be used on both the axilla once. So it should be used once only in 24 hours. Should not be used more frequently than once 24 hours. Simple cloth is there, topical application is there, decrease the sweating. So used for primary axillary hyperhidrosis. Okay. The next drug is a monoclonal antibody. It is called caplacizumab. Caplacizumab. Basically, it is a monoclonal antibody against von Willebrand factor. What happens is, there is normally interaction between large, we can say ultra large von Willebrand factor multimers with platelets. So normally platelets and von Willebrand factor interact, and that lead to immediate platelet adhesion and consumption. Okay? So this is the main problem in acquired thrombotic thrombocytopenic purpura. So what is the basic problem in TTP, thrombotic thrombocytopenic purpura, is the platelets, the large molecule bind to the large molecules of von Willebrand factor, and that result in thrombosis. So this is stopped by caplacizumab. It is a monoclonal antibody against von Willebrand factor. Okay? So from the name you can remember, it is a MAB, means monoclonal antibody. It is used in circulation, and it stops the interaction of PLA, means platelets, with von Willebrand factor. Platelet and von Willebrand factor will not be able to interact, so it is used for thrombotic thrombocytopenic purpura, acquired thrombotic thrombocytopenic purpura. Okay. Now moving to another new drug very recently approved. It is siponimod. Siponimod, if you can correlate the similar name of some other drug you must have read earlier. Yes, fingolimod. So it is a drug similar to fingolimod. Fingolimod, it was also used in multiple sclerosis. It is also the similar drug. It is basically acting on sphingosine 1 phosphate receptors. Sphingosine 1 phosphate receptors. Basically, by modulating this receptor, the lymphocytes, they cannot go out of the lymph nodes. So when they are not able to go in the neurons, the symptoms of multiple sclerosis will decrease. Okay? So it is indicated in relapsing remitting forms of multiple sclerosis. It acts as a sphingosine 1 phosphate receptor modulator. The main mechanism is it inhibits the egress of lymphocytes from the lymph nodes. Okay? And the name tells its mechanism. It is saying sphingosine 1 phosphate receptors. SIP, as for sphingosine 1 phosphate, I look like what? Sphingosine 1 phosphate receptor. Then O means it can be given orally. It is an oral drug. And N means it is used for neuronal condition which is multiple sclerosis. Neuronal condition which is multiple sclerosis. So siponimod, the name says, first of all, it is similar to fingolimod, means for multiple sclerosis you should remember. Then it is sphingosine 1 phosphate, SIP, sphingosine, I look like 1, P means phosphate. It modulates sphingosine 1 phosphate receptor. O means oral drug, N means neuronal condition, that is multiple sclerosis. Okay. Next is a drug S-ketamine, S isomer of ketamine. So this is, we all know ketamine is NMDA blocker, and it is a non-competitive NMDA blocker. non-competitive NMDA receptor blocker of glutamate. It is indicated in treatment-resistant depression. It's a new drug which is approved for oral treatment of treatment-resistant depression. When many drugs are antidepressants are given but not able to treat, it can be treated by S-ketamine, which is supplied as a nasal spray. Intranasal administration S-ketamine. Intranasally it has been approved, but problem with this is it has a lot of black box warnings are to be written on the drug label, and these important include sedation and dissociation. We know ketamine can cause dissociative anesthesia, so that problem can occur. It can cause dissociation and can cause sedation. Then it can be abused. We know it is a drug of abuse, and there are increased risk of suicidal tendencies also with ketamine. So this need to be kept in mind. It can cause sedation and dissociation. Potential for abuse is there, and increased risk of suicidal thoughts are there. It is not approved in children, and exact mechanism is not known. But just remember, ketamine is approved for S-ketamine is approved for treatment-resistant depression, and it is given by intranasal route. Okay. Now this is another drug which is called solriamfetol. Now this is a new drug, just like we discuss SSRIs and SNRIs in depression. So this is a drug, this is known as DNRI. That means it is dopamine and noradrenaline reuptake inhibitor, DNRI. Dopamine noradrenaline reuptake inhibitor, and you can find from the name contains RI, means it is reuptake inhibitor. Normally we use SSRI, SNRI, but it is DNRI, dopamine noradrenaline reuptake inhibitor. Now this drug, it is approved basically to increase the wakefulness. It is used basically in the conditions where there is sleepiness, and sleepiness is associated with two main problems. One in narcolepsy, and second in a patient with obstructive sleep apnea. So this drug solriamfetol, it is approved to improve the wakefulness in patients with narcolepsy and patient with obstructive sleep apnea. It acts by inhibiting the reuptake of dopamine and noradrenaline. But important thing is, if given late in the day, it can interfere with the sleep pattern at night. So it must be given orally on awakening, as early as the person rises. So we should give. Exact mechanism is not known. Coming to same question, how to remember. So you can remember it. The name says it is oral drug. It is given orally. Solriamfetol hai, to O means oral. Then RI we discussed, it is reuptake inhibitor. It inhibits the reuptake of dopamine and noradrenaline. And from the name you can remember amfetol. Amfetol look like amphetamine. So it work like amphetamine, means it promote wakefulness. So it is used in conditions like narcolepsy and obstructive sleep apnea. Solriamfetol. So from the name you can remember, RI means reuptake inhibitor, amfetol means amphetamine like drugs, and O means oral drug. Clear? Next new drug which is approved is brexanolone. Brexanolone is nothing. It is just like a neurosteroid which is normally present in the brain. It is called allopregnanolone. So brexanolone is nothing but allopregnanolone. Okay? So basically neurosteroids, they act as a modulator of GABA receptors. So it is also a GABA A receptor modulator, and it is a new drug which is indicated in depression, but a special type of depression called postpartum depression. It is indicated in postpartum depression and given by intravenous route. Now because it is affecting GABA receptors, so it can produce excessive sedation. So that need to be kept in mind. Excessive sedation or sudden loss of consciousness can occur. With the use of brexanolone, excessive sedation or sudden loss of consciousness can occur. So basically it is a GABA modulator. It is a neurosteroid called allopregnanolone. Okay? So from the names you can find something like brexanolone similar to allopregnanolone. So it is allopregnanolone. Now another important thing, from the name you can remember pregnenolone, so it seems like pregnancy. pregnancy. So it is given after pregnancy, that means postpartum. So it is indicated in postpartum depression, brexanolone. Okay. GABA receptor modulator, basically neurosteroid. Okay. Now next drug is atezolizumab. This is not a typical new drug because it is already present for other conditions we discussed earlier also. It is already approved in treatment of urothelial carcinoma and also for non-small cell lung cancer, and recently it is approved for small cell lung cancer. Non-small cell, it is already present, so it is approved now for small cell lung cancer, given by IV route, atezolizumab, if you remember. Now as we discussed earlier also, normally there is a special type of mechanisms used by tumor cells called as negative immune regulation. So this we can target to treat the cancers. First of all, we'll try to understand again. There are many normal cells in the body against which immunity does not work. The reason is, one of the methods is how T cells recognize that this is a normal cell and I do not need to attack. Whereas this is a foreign cell, this is a tumor cell, this is a viral cell, I should attack. So one of the method is that on the T cells there is presence of receptors called as PD-1. On the T cells, programmed death 1 receptors are present. Now if other cell, which is a normal cell in the body, it expresses a ligand for that PDL1, then there will be interaction between the PD-1 of T cell and PDL1 of the normal cell, and when this interaction occur, now T cell are inhibited. Negative immune regulation, that means you can understand T cell recognizes that it is a normal cell, so I will not attack. The same method is utilized by cancer cells also. So many tumor cells start expressing this ligand. So if this ligand is expressed on the tumor cell, now the T cell start recognizing it as a normal cell. So T cell do not attack, and when the T cells do not attack, the tumor cells survive, and that lead to proliferation of the cancer. Clear? So the researchers who got the Nobel Prize, they targeted this pathway. So what they developed is, they developed some drugs which will bind either to PDL1 present on tumor cells or to PD-1 present on the T cells. So now there will be no interaction between the tumor cell and T cell. So T cells will not recognize tumor cell as normal, so they will start secreting the interleukins, and that will kill the tumor cells. That is the basic idea. So atezolizumab, avelumab and durvalumab, they are monoclonal antibodies against PDL1, whereas pembrolizumab, nivolumab and semiplumab, these are monoclonal antibodies against PD-1. Clear? So atezolizumab we discussed earlier, it is already approved for non-small cell lung cancer and urothelial carcinoma, and very recently it is approved for small cell lung cancer also. Clear? Now moving to another drug, latanoprost in combination with nitarsudil. So these are the drugs we discussed earlier also. Latanoprost we all know. It is a prostaglandin F2 alpha, and in the name it is written, it is prostaglandin which is acting on ocular area, or we can say ocular prostaglandin. It is PGF2 alpha. It is used in glaucoma. It acts by increasing the uveoscleral outflow. Now second drug has been found which is called nitarsudil. Can you correlate it with some other drug which we have studied earlier somewhere? The other drug, the name which is similar to that is fasudil. So drugs ending with sudil, fasudil, nitarsudil, these drugs are Rho kinase inhibitors. They are inhibitors of the Rho kinase. Fasudil we studied in angina. Rho kinase inhibitor. Nitarsudil is used in glaucoma. It increases the trabecular outflow. So basically when we combine the two, we increase the trabecular outflow by nitarsudil and uveoscleral outflow by latanoprost. So that drug is useful in glaucoma. So this combination is given topically. Local eye drops are given for open angle glaucoma. Clear? Moving to next drug, ravulizumab. Now ravulizumab, it is a drug similar to eculizumab. Do you remember eculizumab we discussed earlier? If if you remember, eculizumab is acting against the complement component C. E is the fifth letter, so C5. It is a monoclonal antibody against C5. The same is done by ravulizumab. It is also a monoclonal antibody against complement component C5, and we know this component is overactive in paroxysmal nocturnal hemoglobinuria. So ravulizumab is also approved against same condition, that means PNH, same as eculizumab. The only difference is ravulizumab is long acting, so it need to be given once every 8 weeks, whereas eculizumab was given every 2 weeks. So every 8 weeks it can be given, long acting drug similar to eculizumab, you can say. So but the special black box warning is given. This drug ravulizumab carries a black box warning that it increases the risk of meningococcal infection. Meningococcal infections and sepsis can occur. So before giving this drug ravulizumab, the person must be vaccinated for meningococcal disease. Clear? Now moving to next drug, it is tagraxofusp. Tagraxofusp. So this drug is actually a fusion protein. This is a fusion protein. So basically what is fused in this is, there is truncated diphtheria toxin. Truncated diphtheria toxin, which is the main active ingredient. So this will be the main active compound. It is fused with interleukin 3. Interleukin 3. So there is interleukin 3 and diphtheria toxin, they are linked together. So what happens is, the receptors of interleukin 3 are present or overexpressed in a special tumor called as blastic plasmacytoid dendritic cell neoplasm. Blastic plasmacytoid dendritic cell neoplasms, these cancer cells, they express a receptor called CD123. CD123 is the receptor expressed on these cancer cells, and interleukin 3 bind to these CD123 receptors. So when we give this drug combination, this fusion protein, the interleukin 3 of this protein bind to these tumor cells. So that means specifically only inside the tumor cells this diphtheria toxin is given. So diphtheria toxin enters only the tumor cell, targeted against those only. So it will inhibit the formation of proteins, elongation factor is inhibited, and that will kill the cancer cells. So that is special thing to remember. But problem is, this drug can cause capillary leak syndrome. Special side effect of this drug is capillary leak syndrome. Tagraxofusp. And from the name you can remember, this is not given orally. X means cross, means not, O means orally. So it is injectable drug given intravenously. So revising, tagraxofusp is a fusion protein. It is a fusion protein between truncated diphtheria toxin and interleukin 3. Interleukin 3 will bind to CD123 present on the cancer cells, and truncated diphtheria toxin specifically enter those cells only, inhibit their protein synthesis, kill those cells. Clear? And the tumor it treats is blastic plasmacytoid dendritic cell neoplasm. Clear? Moving to next drug, Gall asparagine pegol. Now the name tells everything about this drug, asparagine. So basically it is asparagine. Pygylated, pegol means pygylated, means long acting. So it is nothing but L-asparaginase. It is an enzyme which is long acting. We already have L-asparaginase as drug. Remember, L-asparaginase breaks asparagine into aspartic acid and ammonia. So basically it breaks an amino acid. Now important thing is, asparaginase normally was used in acute lymphoid leukemia. The basic concept behind that was, leukemic cells, they cannot synthesize their asparagine, so they are dependent on the exogenous source of L-asparagine for survival. Normal human cells can form asparagine, but leukemic cells are not able to form. So when we give asparaginase, it breaks the normal asparagine. So when normal asparagine is not available, normal cells can form them, but leukemic cells cannot form them. So specifically leukemic cells are killed because they are not able to form their proteins. Okay. Now asparaginase was relatively short acting, so we developed a drug called Carl asparagase pegol. Pegol means pygylated, and when it is pygylated it become long acting. Okay. So like asparaginase, it is given for ALL, acute lymphoid leukemia. Okay. Next is prucalopride. Like other parides or cisapride, mosapride, this is also 5-HT4 agonist. 5-HT4 agonist, and it is also a prokinetic drug like all other drugs, and this is now recently approved for treatment of chronic idiopathic constipation. Prucalopride is recently approved for chronic idiopathic constipation. Prokinetic drug, increased GI motility. Okay. Now next is a tyrosine kinase inhibitor. It is called gilteritinib. This is a tyrosine kinase inhibitor, drugs ending with nib are tyrosine kinase inhibitor. This is specifically indicated for acute myeloid leukemia. Acute myeloid leukemia, which contain a specific mutation called as FLT3 mutation. There are many types of mutation in AML. So this is indicated for those patients who have FLT3 mutation. Now if you see, there are many drugs which are approved for AML. I already told you there are many types of mutations which can be targeted. Now the drugs targeting the FLT mutation which we just discussed, these are midostaurin and gilteritinib. Midostaurin and gilteritinib. Another mutation which is commonly seen in AML patient is isocitrate dehydrogenase mutation. Isocitrate dehydrogenase. Now the drugs which target this IDH mutation are enasidenib and ivosidenib, and we discussed in our earlier class here also, these drugs are containing SID in the name. If we rearrange SID, it become ISD, means isocitrate dehydrogenase. So it is against isocitrate dehydrogenase. It is a tyrosine kinase inhibitor again. Then another target for AML CD33. The monoclonal antibody against CD33 is gemtuzumab ojogamicin. Gemtuzumab ojogamicin is a monoclonal antibody targeting CD33. Another target for AML is BCL2. BCL2 is also overactive in chronic lymphoid leukemia, and the drug which is targeting BCL2 is venetoclax. So venetoclax can be used for CML as well as CLL as well as AML. So CLL you can remember from the name BCL2. So they are saying write L twice. So CL2, CLL. Venetoclax used for CLL as well as AML. And one last pathway is Hedgehog pathway. Now Hedgehog pathway is overactive in mainly basal cell carcinoma and also for AML. So the drugs which end with the DAGIB, they are Hedgehog pathway inhibitors, and a DAGIB called GLAS-DAGIB, it is recently approved for AML. Clear? The drug we were just discussing, GLAS-DAGIB. So the drugs which end with the DAGIB, they are Hedgehog pathway inhibitors. Again from the name you can remember, this is containing DEG. DAGIB contain DEG, and same DGE is written, but just you need to rearrange. In Hedgehog there is written DGE. So the drugs which contain DGIB, DAGIB, they are Hedgehog pathway inhibitors, and this pathway is overactive in some cancers, particularly two cancers, one basal cell carcinoma and second AML. GLAS-DAGIB is approved in AML. Whereas other DAGIBs like Vismo-DAGIB and Soni-DAGIB, they are approved in basal cell carcinoma of skin. GLAS-DAGIB is approved in acute myeloid leukemia. Now one special thing to remember, the antifungal drug itraconazole, it also inhibits Hedgehog pathway. So maybe asked in the exam, itraconazole also possesses Hedgehog pathway inhibition property. Okay. Now moving to another drug, amifampridine. Can you recall some other drug with similar name? Yes, it is dalfampridine. So it's a drug similar to that, dalfampridine. Now it is amifampridine. Ampridine, they are aminopyridines. These are potassium channel blockers. Dalfampridine was used in multiple sclerosis, whereas amifampridine has been approved in Lambert-Eaton myasthenic syndrome. Clear? The next new drug is larotrectinib. Larotrectinib, again the name tells it is a nib, means tyrosine kinase inhibitor. It is a tyrosine kinase inhibitor. Now this is a tyrosine kinase inhibitor against a gene called as NTRK gene. NTRK is neurotrophic tyrosine receptor kinase. Neurotrophic tyrosine kinase receptor. So if we write here new, so it will become neurotrophic tyrosine kinase receptor inhibitor. So from the name you can remember larotrectinib is neurotrophic tyrosine kinase receptor inhibitor, or simply neurotrophic receptor tyrosine kinase inhibitors. Okay? Larotrectinib. Okay. Now special point about this drug is it is not approved for any particular organ cancer. This drug is approved for any cancer which have this mutation. So any cancer having NTRK gene mutation, we can use larotrectinib. It is used for any solid tumor. So this is the first drug where such indication has been made, where irrespective of organ of origin of the tumor, the drug has been approved. So any organ tumor which contains NTRK gene mutation, we can use larotrectinib. This is a special thing. This is not for any particular organ. It is for particular mutation. Next drug is emapalumab. So if you see, this is little funny. So normally in Sargam we have sa re ga ma pa da ni sa. Okay. So if we see, we have sa re ga ma pa. So ga ma pa. So that means it is against gamma. So it is a monoclonal antibody against interferon gamma. Monoclonal antibody against interferon gamma. Okay. And interferon gamma, its overactivity is associated in a condition known as hemophagocytic lymphohistiocytosis. So a type of histiocytosis, hemophagocytic lymphohistiocytosis. In this condition, interferon gamma is overactive. So the monoclonal antibody against this interferon gamma can be used for treatment of hemophagocytic lymphohistiocytosis, and that drug is emapalumab. So you can remember gamma pa means interferon gamma. Clear? Next drug is easy, rifamycin. It is a drug similar to rifampicin. So this drug is similar to rifampicin, given orally. Same mechanism, bind to beta subunits of DNA dependent RNA polymerase. Okay. Now this drug is approved in traveler's diarrhea caused by E. coli. Traveler's diarrhea by E. coli, rifamycin has recently been approved. Okay. Another drug is revefenacin. Have you heard similar names earlier? Yes, darifenacin, solifenacin, yeah, all these are anticholinergic drugs. Darifenacin and solifenacin, these are M3 blockers and they are used for overactive blood, whereas revefenacin also block M3, but it is mainly acting on the bronchus. So it will cause blockage of M3 leading to bronchodilation. So it has been approved in COPD. Chronic obstructive pulmonary disease. It is given by inhalational route. Revefenacin is inhalational drug for COPD and it is a long acting anticholinergic drug. Okay. Now moving to another drug which is called lorlatinib. Lorlatinib, like many other ALK kinase inhibitors, so this is also inhibiting the tyrosine kinase activated by ALK, and this ALK is overactive in non-small cell lung cancers. The drugs inhibiting this ALK are used for non-small cell lung cancer. The special point about lorlatinib as compared to other ALK inhibitors is it is a third generation drug in this category, and this drug is more potent than other drugs and it has more entry in the brain. More potency and more entry in the CNS. The first generation ALK inhibitor was crizotinib. Second generation drugs include ceritinib, alectinib, brigatinib, and ensartinib. and lorlatinib is the third generation drug, recently approved drug in this category. So for non-small cell lung carcinoma. Clear? Now next drug is baloxavir marboxil. Basically this is a drug which is a pro-drug. It is metabolized and marboxyl group is removed, so the active compound baloxavir remains. So this baloxavir, as the name tells, it is against virus. Baloxavir against virus. It is against influenza virus. It is against influenza virus. It is given orally. It is given orally for acute uncomplicated influenza virus. So this drug basically inhibit RNA polymerase, or simply formation of messenger RNA in the bacteria. RNA polymerase will not be able to work, transcription will not occur, and it inhibit that by inhibiting the endonuclease activity of the PA protein of the virus. In the RNA polymerase complex, one of the protein is required, which is called PA protein. Baloxavir inhibit that PA protein in the influenza virus. So it is used for oral treatment of acute uncomplicated influenza viruses like bird flu and swine flu. So new drugs for bird flu and swine flu, baloxavir. The drug of choice for bird flu and swine flu is, yes, oseltamivir group of drugs. They are neuraminidase inhibitor. And this is inhibiting the RNA polymerase. Okay. Another anti-cancer drug recently approved is talazoparib. Talazoparib is approved for breast cancer. The name of talazoparib says everything. Talazoparib. It is an oral drug. O means oral drug, and it acts by inhibiting poly ADP ribose polymerase enzyme. This enzyme PARP, poly ADP ribose polymerase, overactivity of this enzyme is responsible for many cancers. So inhibitor of this can be used for treatment of cancers. The drugs like olaparib, rucaparib and niraparib, they are already available PARP inhibitors, and talazoparib is a new entry in this category. A new entry in this category. Other drugs were approved mainly for ovarian cancer, whereas talazoparib has been approved for breast cancer. Okay. Now next is a drug called inotersen. This is a drug which is a antisense oligonucleotide. So this is a nomenclature that antisense oligonucleotide must end with arsen. Arsen, sense. You can remember sense. Antisense oligonucleotide. So this drug has been developed as an antisense oligonucleotide against mutated transthyretin. Mutated transthyretin protein. You must have read about amyloidosis. In amyloidosis, particularly that amyloidosis in which there is mutation in transthyretin gene, and that result in formation of a mutated TTR, transthyretin mutation. Yeah. So in this mutation, in this amyloidosis, there is neuropathy, polyneuropathy. So inotersen bind to that mutated transthyretin protein and treat the polyneuropathy. Okay? So polyneuropathy caused by hereditary transthyretin mediated amyloidosis. Okay? This drug is given subcutaneously, and the major side effects include thrombocytopenia and glomerulonephritis. Thrombocytopenia and glomerulonephritis are the main side effects, and the mechanism of this drug we can remember from the name inotersen. So you can say inhibit. I means inhibit, N means neuropathy, of, O means of, T means transthyretin mediated amyloidosis. Inhibit. I means inhibit, N means neuropathy, O means of, TTR. Inhibit neuropathy of TTR mediated amyloidosis. Okay? And it is an antisense oligonucleotide. It ends with arsen. It is antisense oligonucleotide. Okay? The next new drug is elapegadimase. Elapegadimase. The name says everything about this drug. So it is pegylated. PEG is pegylated. Pegylated means long acting. It is pegylated adenosine. A means adenosine. adenosine deaminase. So it is nothing but a recombinant adenosine deaminase. It is PEGylated, so it is long acting. And we know adenosine deaminase deficiency leads to which disease? Yes, severe combined immunodeficiency. So severe combined immunodeficiency due to ADA deficiency, it can be treated by replacing this. So basically it is a replacement therapy, alapegadimase. It is given intramuscularly. It increases the lymphocytes, and that will treat the condition SCID, severe combined immunodeficiency. Okay, so these are the important and new drugs which have been approved recently. Thank you.